Good afternoon. My name is Callista Ross, and I'm the Director of Development at the Clinton Presidential Center. Thank you for joining us this evening for our third and final conversation on health equity. We started this series in April as a way to convene health experts and practitioners to discuss issues that impact millions of Americans, as well as provide solutions and action items that can make a difference. We've covered a lot of ground, but the journey is far from over. The Clinton Foundation has a long-standing commitment to health equity. In addition to the Conversations on Health Equity series, initiatives across the foundation have convened programming focusing on the topic. Last October, President Clinton and Chelsea Clinton hosted a CGI University event with Morehouse College that brought together leaders in business, public health experts, and students to discuss ways to build an inclusive society, promote health equity, and support student leaders amid the COVID-19 pandemic. In April, at the meeting of the Clinton Global Initiative Action Network on Inclusive Economic Recovery, President Clinton and Chelsea Clinton announced new commitments to action that provide support and resources to small businesses in their efforts to address health equity across the country. Our final program today will focus on the root causes of health inequity, what got us here, the solutions, and where we need to go. We're so fortunate to have 4 subject matter experts sitting on the panel today. Mayra E. Alvarez, who leads the Children's Partnership and is a member of the Biden-Harris administration's COVID-19 Health Equity Task Force. Dr. J. Bhatt with the Medical Home Network and University of Illinois School of Public Health. Dr. Brian Gittens, Vice Chancellor at the University of Arkansas for Medical Sciences, and Lupe M. Rodriguez, who leads the National Latina Institute for Reproductive Justice. Our next speaker will properly introduce our moderator, but I would be remiss if I didn't thank the remarkable Dr. Nash for helping us navigate this timely topic. We're so grateful to our sponsors, the Derek Lewis Foundation, the National Medical Association, and the Arkansas Medical, Dental, and Pharmaceutical Association. And this series simply would not have been possible without the support of our presenting partner, Bank of America. It's my honor to turn the program over to Heather Albright, President of the Arkansas Market for Bank of America. Heather?
Thank you very much, Callista. On behalf of Bank of America and my Little Rock-based teammates, I'm very pleased to join everyone virtually today. Bank of America is honored to be the presenting sponsor of this informative series of conversations, as well as being a long-standing partner with the Clinton Presidential Center and the Clinton Foundation. We're committed to supporting programs such as this that bring thought leadership and discussion to the forefront. In fact, a vital way that Bank of America continues to drive meaningful, sustainable progress is through open and honest dialogue with each other on important issues of inclusion and equality and the barriers to achieving them. We've been doing this for several years, and we will do more, organizing courageous conversations with each other, clients, community members, and external leaders. The key to these conversations is how they have helped all of us to learn, to build understanding, and to drive needed change through our company, programs, policies, and sustainable finance efforts. Additionally, in March, we announced an increase to our commitment to advance racial equality and economic opportunity to $1.25 billion over 5 years. This effort further accelerates work already underway to address racial equality and opportunity through direct actions, investments, and work to catalyze similar efforts across the private sector. This commitment is focused on 4 key pillars: supporting minority-owned businesses and entrepreneurs, investing in upskilling and reskilling to connect students and adults to jobs and long-term career opportunities, supporting health through PPE donations and access to vaccinations, helping provide access to affordable home ownership and housing. As we continue to make our way through this year, there are many reasons for growing optimism. The continued decline in positive cases and the ongoing rollout of vaccinations have led more and more communities to open up. And as a result, we're seeing improvements in unemployment, consumers are spending more than ever, and many businesses are beginning to recover. We're proud to play a key role in this recovery. We look forward to continue the dialogue around economic mobility and racial equality and applaud the Clinton Foundation for providing this informative and interactive series that will shine a light on a more equitable healthcare system. It is my honor and privilege to introduce today's moderator, Dr. Chriselle R. Nash. Dr. Nash is the Medical Director for Health, Equity, and Public Programs at Arkansas Blue Cross and Blue Shield. In this role, Dr. Nash provides leadership for developing, implementing, and evaluating health equity initiatives to help create a more inclusive and non-discriminatory healthcare system through Arkansas. In addition to her role at Arkansas Blue Cross, Dr. Nash is adjunct faculty in the Department of Health Policy and Management at the University of Arkansas for Medical Sciences College of Public Health, where she is the co-director of the Racial and Ethnic Health Disparities Service Learning course. Dr. Nash?
Dr. Nash, you're muted.
Yeah, you've been muted.
My apologies. I did not realize that Murphy's Law happens. Welcome, everyone, and I'll just be very brief. Thank you for joining us, and thank you for the panelists, and thank you for letting me know I was muted. They bring an awesome group of experience and expertise, and for me, really inspiration in this topic of health equity as we continue this discussion. Please take a minute to look at their bios when you have an opportunity. They span advocacy, health policy, practice, organizational practice, from the local level to the international level. So I'll stop right there and say, let's get right to the topic. My apologies. My first question. We all know that the COVID-19 pandemic has really illuminated long-standing disparities in our country and has raised really the public discussion about health equity. So my first questions are directed to Mayra and Jay. How has COVID-19 exacerbated inequities in health care, specifically among the patients and communities that you serve?
So, Mayra, you want me to start?
Sure.
Thank you for being here today for this conversation. I'm just honored and humbled to be a part of it, and really appreciate the incredible work of the Clinton Presidential Center and my colleagues on this panel. I think about it this way: health inequities is America's chronic condition. We've worked on this issue, but we've put Band-Aids on it. And I'll tell you that as a primary care doc on the south side of Chicago, where I see my patients, a woman 45 working 2 jobs, one on a public transportation system and another in the grocery store, one day in last spring show up in my clinic feeling sick, but had no choice about how she would be able to be in community, make living for her family. There's a difference, I think, when we think about disparities, differences in health versus inequities, differences in health outcomes that are preventable, which also make them unjust. And so in Chicago, where I live, Black residents make up 30% of the city's population, but they accounted for 60% of COVID-19 fatalities. And it's the social conditions, the structural racism, the lack of intergenerational economic mobility, and other factors that elevate risk for COVID-19 diagnoses. And I also see that there are numbers related to discrimination that impact how people manifest their health, from coronary artery disease to high blood pressure, to impact on mental health and impact on sleep. And that shows up in the front door of my clinic and in the office and in the homes where I go to see patients and vaccinate them. Those conversations help build trust, which is also lacking, which contributes to inequities in our health care system and in our communities. And so the numbers that we have seen through COVID-19 should shock us, and more importantly, stir us to action, because we're putting people back to the structurally unequal living conditions and conditions that make them sick. And so I think about not only my patients that are in front of me, but that our neighborhoods as if they were our patients. That means combating the systemic racism that keeps people of color poor and sicker than their white counterparts. It means building state-of-the-art care delivery, not just in rich neighborhoods, but in neighborhoods where the sickest, most vulnerable people live, providing equitable, accessible, high-quality, affordable healthcare to all Americans, regardless of their zip code. And lastly, it means committing ourselves to opening up professional opportunities to people of all backgrounds and guaranteeing that our health systems mirror the diverse communities they aim to serve.
So if I could just build on Jay's comments, I think, the reality is that the inequities that the pandemic has made all the more clear are piled on top of what we knew was real before the pandemic even hit. And I think that is the case because of who has actually been hit hardest by this pandemic. And I should say multiple pandemics, right? Because if we think about the last, 15, 18 months of our lives, there have been multiple pandemics piled on top of our communities. Yes, it's COVID-19, but it's also the impacts of COVID-19 and the challenging economy that so many of our families are facing, and this continued national reckoning on racial injustice that, again, disproportionately targets certain communities. In particular, communities of color, Black, Latinx, Filipino, immigrant families who continue to bear the brunt of the pandemic and the devastating consequences, but also continue to shoulder the frontline work that's keeping our country's economy running. And these are the very populations that before the pandemic were actually disproportionately impacted by chronic diseases anyway. And that's linked to what Jay said, many, many issues, but the underlying structural racism that exists in our systems. So the fact that so many people of color have barriers to care, have barriers to coverage, have barriers to healthy foods or safe neighborhoods, and all of these conditions that then contribute to these inequitable rates of chronic disease, illness, that put them in a more vulnerable position to be hit hardest by COVID, piled on top of those jobs that requires them to be on the front line, taking care of those of us that are privileged enough to be able to work from home, those of us that are privileged enough to order food delivery or get these services that we know someone is making possible for us. Populations here in California, like farm workers, undocumented immigrants. Many of our most marginalized communities have been hit hardest by these illness, by COVID-19, and again has exacerbated the disparities that we know existed beforehand. And before I pass it on to others, that is not only linked to the direct impacts of COVID-19, but also the indirect impacts. So how is that impacting the children of these individuals and their access to more safe communities, or the health of their parents? They're that way much more susceptible as a result of it. And it's only exacerbating, again, the inequities that we know existed before the pandemic.
Thank you. Thank you. So given that context, my next question is for both Brian and Lupe. In that context of the pandemic and moving to whatever the new normal is going to be, do you think we are collectively in a better or worse position to improve health equity moving forward?
Sure, I'll jump in, Lupe, if you don't mind. Yes, I think we're in a better position. I think that we are more aware of what's needed to advance, health equity during the pandemic. I think we've become more aware of the gaps that exist with regard to trust, with regard to communication, with regard to how do we get the general public to become more aware of where to get help, of the resources and the like. So I think that the needle has moved in that way, in that we recognize that we can't go this alone, that we have to have these wonderful partnerships, whether we're talking about UAMS, whether we're talking about AMDPA, whether we're talking about Minority Health Commission and the like, that we have to come together because these are common problems and common issues. And so I think we've become aware of the magnitude of the issue. Now, I know there's work underway throughout the state of Arkansas, at least, with regard to building sustained infrastructure to address whatever the next pandemic might be. And so I think we're in a better place. This is a generational sort of situation we're in. And I think we did get caught sort of flat-footed in some ways as a result of that. But I think that we're a better position moving forward, in my opinion.
Yeah, I'll jump in now and say that, I think I'd like to reframe the question a little bit, because while I agree with Brian that we have found a newfound awareness around the inequities that exist in our healthcare systems, and are really thinking about how to approach them. And the pandemic has helped us see that in a new way. I think we've been in this difficult position for a long time. And I think that despite that, I think we need to be able to move forward. I'd like to just share a little bit about the fact that some of the longstanding barriers that have made it more difficult for the Latina and Latinx community, specifically other communities of color and immigrants specifically. The other panelists have talked about the fact that all of the conditions that have existed for these communities for a long time have only been made worse, have only been exacerbated. And, and specifically around immigrants, I'd like to add that so many of our community members who are immigrants, who have immigrants in their families, have already experienced incredible barriers, including things like the structure, besides structural and economic barriers, things like the fear that has been sowed by anti-immigrant measures throughout in the country in the last many years. And those things have continued to have an effect and continue to have an effect now. And one of the things that I'd like to highlight is the fact that, despite the fact that we're moving forward on increasing vaccination, on ensuring that we connect with folks around the things that need to happen in order for us to be able to, get back to quote unquote normal, we know that folks who are immigrants, who have folks in their families who are undocumented, have myriad barriers still to even getting vaccinated, to getting in for healthcare services during this pandemic, and face barriers to getting to the point where we can get out of the conditions that we're experiencing right now in this health crisis. And so I want to lift that up because I think it's important that, despite all of the barriers that exist, I think I agree that, again, we have the potential to move forward. But I think it takes addressing those specific barriers that some of our most marginalized, or some of our communities who have been the most marginalized, are facing. And I'll just end with putting in a plug for a bill that's in Congress right now called the Heal for Immigrant Families Act, which was introduced both in the Senate and in the House of Representatives, and would lift the 5-year bar for green card holders and remove the current barriers to the ACA marketplace for undocumented individuals, so that folks can actually get into healthcare and have easier access. So again, we have a lot of work to do, but I definitely see and agree that we have the opportunity to move forward, and there's more information, more awareness, I think, and that's in our benefit and opportunity.
Thank you. I want to open up. This is a slightly different bend on the question, but open it up to the whole panel. As healthcare professionals and advocates, you've already identified for the audience all the different intersections and barriers from multiple different areas that have been long-term. A part of us being here today is the increased awareness. How do we increase public understanding and awareness of the problem so that we can do those long-term things, Lupe, that you talked about, and support the policies that we know will make a difference, and ultimately move the needle on health equity? Does that make sense? How do we continue such that, my fear is that the PR that has been created around health equity, once that goes away, what happens? Anyone can jump in. Jay, you're on.
Sure. So, I think one of the things that's been so striking about this last 15 months or so is that the issue of COVID-19 affecting everyone has allowed for the conversation of equity to grow and become much more apparent. How do people that get the same virus have different outcomes and are disproportionately affected? And so I think that, that is a piece we have to continue to lift up. The other, and then what happens to them downstream, how they're impacted in their economic mobility, their families, their ability to contribute in society, and the downstream chronic conditions, including mental health, that impacts them. And then I think it's the data. It's raised this conversation about disaggregating data, which, you know, people are not invisible. People are not lost. People are beyond the numbers, individuals who have families and who have lives and who are contributing to this country. And so I think we need to tell those stories as well. And when we think about why do some people get paid sick leave and others don't? Why do some people get parental leave and others don't? I mean, these are things that people had to grapple with in education, in our education system as well. So I think lifting up some of those issues, you know, are other ways. And then talk about the hope and the ways that we have actually come together, have created partnerships, have tried to move the ball on equity, and how do we sustain it so we move towards equitable recovery in the moment forward.
I think I agree with Jay with regard to looking at all these social determinants of health, right? Whether we're talking about education, employment, housing. A big conversation, as you remember, over the last year and a half or so has been around essential versus non-essential workers, for instance, and looking at the socioeconomic impact of that. As essential workers are oftentimes service workers, or those, as mentioned earlier, who do not have the luxury of working from home and things like that. So what can we do to protect those? So I think there's lots of opportunities to look at our infrastructure, our systems, our employment practices and policies as well to improve that. We can't predict, you know, what the next crisis is going to be, but given some of the lessons that we've learned, it needs to be prudent of us to look at our infrastructure. We're better prepared to look at how we do things so that so the next crisis won't be as debilitating as this one was. So I think there are lots of opportunities, as Jay mentioned. I think we illuminated a bunch of things, and there's lots of work to be done.
And I think building on both Brian and Jay's comments, in particular Brian's earlier comments, I think there's something to be said about the multiple ways of reaching people with information in today's society, whether it's on social media or on, you know, television, radio. The last year and a half, or not even, actually not year and a half, the last, you know, 6 months, we've had a robust effort to get the data out there. You know, the fact that we've been able to see clearly the racial inequities on how COVID has impacted certain communities on our daily news, right? The numbers that are reported at the local level, to the extent that states are disaggregating data and reporting it by race, ethnicity, and at least a lot of times they are, the CDC is, that is telling a story that no one can turn a blind eye to. And it's surround sound. And as a result of that, it's illuminating, again, what we knew as far as inequities existed before, but it's bringing other people into an awareness that didn't exist before. And I think that narrative shift, as Brian mentioned earlier, is something that we need to hold on to so that it isn't this a blip in you know, moment in time, but that we're going to make the long-term investments to ensure that we're not allowing these inequities to continue. There's no going back to normal. No going back to where we were, because that was a system of care that left people behind. And now that this awareness is out there, how can we redirect for the future to ensure that we are minimizing those inequities? And I think that surround sound strategy, getting that information out, disaggregating data, empowering people to know the numbers will enable us to get there that much more effectively.
Yeah, absolutely. I want to hone in on what you said, Mayra, about engendering deep investment in communities by organizations that are funding social work and work to increase equity in our communities. I think you know, specifically just in terms of tactics around this, something that we do a lot is storytelling and really bringing to the fore the experiences of the folks who have been most impacted by this pandemic and by inequities, and not only their stories, but bringing them to the fore of the work as well, ensuring that with these deep investments, we're supporting the building of the power of community members who are most impacted to be able to advocate for themselves and their communities. That's part of the work that we do at Latina Institute, and one of the things that I think is central to creating lasting change. Folks in their community can increase messaging and perpetuate messaging and continue to build power within themselves and their communities to be able to keep this going and keep momentum going, but also can bring their stories and bring their power to decision-making tables like with legislatures and others. So I think that is a really important part of this. And then I'll just add that, like, I think any ongoing campaign that happens around this work needs to center those most affected and really go deep in community to do outreach campaigns to continue to do this work. I think, you know, I agree about the importance of disaggregating data, ensuring that the stories are told, and that but that it's brought to the folks most affected as well, because I think that's where you'll get the sustained change I think that we need to be able to move forward.
Excellent discussion. Thank you. I want to pivot just a little bit to specifically the Affordable Care Act. And this question is from Mayra. Previously, your work included very close, intimate work with the Affordable Care Act, both prior to and following its passage. So my specific question is, how has the Affordable Care Act made the healthcare system more equitable, or has it? And what more is there to do?
Muted.
Oops, first and foremost, unmute. I think it's important, you know, that you think about the impact of the Affordable Care Act and what it did to the conversation around healthcare, and how it elevated the idea that healthcare is a right and not a privilege. The Affordable Care Act, since it was launched in 2010, has allowed for expansion of health insurance coverage to over 20 million people. 20 million people across the country now have the security that health insurance coverage provides because of the health insurance marketplace, or because of the expansion of Medicaid. So it's really recognizing that security that health insurance offers people, especially in the midst of a pandemic. So the last few years, those newly insured people had the opportunity to navigate a healthcare system that they may not have navigated before, and maybe actually had to navigate during this pandemic in ways that they wouldn't have known, right, had it not been for this opportunity. We saw a 40% drop in the last year of the Obama administration in uninsurance because of the Affordable Care Act. Those numbers started to tick back up during the last administration, and now there's an opportunity to go back to what we know is critical as far as outreach and education regarding affordable insurance. And then, to your point, really building on what we know the benefits were. You know, the benefits of the Affordable Care Act weren't just for people that didn't have insurance. It actually strengthened coverage for the tens of millions of us that had health insurance coverage. So making sure insurance companies couldn't deny coverage to people with pre-existing conditions, or making sure that there were no more lifetime limits on your insurance, so you wouldn't be afraid that when you need it the most, your insurance would go away. And then covering a number of preventive services to try to make sure that people can get and stay healthy before it's too late. And to the discussion or the question about what do we need to do now? I mean, already we've seen the president invest in these types of efforts to make the Affordable Care Act stronger through the American Rescue Plan and expanding affordability subsidies so that more Americans can access health insurance coverage at a price they can afford. Really figuring out that these sort of investments are not just an investment in an insurance card, but that insurance card is linked to job security, being able to go to work, being able to pay attention in school, contribute to our communities. Health insurance has been a critical tool for economic mobility. And that sort of investment is reflected in these types of efforts, and hopefully more efforts as we move forward.
Can I just jump in and say that absolutely everything that Mayra said, and you know, I'd like to add again the point about immigrants and their continued exclusion, particularly undocumented immigrants in our ACA. I think, you know, as mentioned, the Heal for Immigrant Families Act would ensure that we remove those barriers for folks from the 5-year bar, for folks who are documented to be able to have access to healthcare sooner, and allow undocumented individuals to be able to buy healthcare plans in the marketplace. I think removing that extra layer of inequity that is baked into the ACA, frankly, is a way to move forward with this and ensuring that everyone in our community has access to healthcare.
I think that what the pandemic has shown is that all of our health is connected, right? No matter who you are. I think that's critically important. In thinking about the pandemic and how else it's impacted the healthcare system, I want to ask a slightly different question to Jay. Throughout your career, you focused really on the design and the delivery of healthcare. And here in the state of Arkansas, like the rest of the nation, telehealth has exploded. But at the same time, during the pandemic, we in Arkansas and in other rural areas of the United States have really seen this digital divide, right? This divide where people either don't have access to broadband or don't have digital literacy. How do you use those services? So my question to you is, how do you see telemedicine or telehealth more broadly impacting health equity?
Well, so before I go into that a bit, I just echo what Mayra and Lupe have said. I think that, as we think about how we're moving forward on care, we want to be able to think about the ways in which we're doing it so that they're equitable. And you're right, telehealth, has been something where it could mean different things, whether it's, I'm often calling patients and families on the phone because they don't have access to internet, or I've had a patient tell me, I'm not gonna use that app or use that technology because it uses up data on my phone, and I have a very small data plan. So unless it makes a difference for me, I'm not going to. And the work that we've done at Medical Home Network, which takes care of 160,000 Medicaid beneficiaries in Cook County, as well as older vulnerable adults in nursing homes and supportive living facilities, is think about how do we bring different modalities together, including home visits, including meeting people where they're at to provide better whole person care, and transforming the way care is managed at the community level. And then building relationships with patients and their care teams so that actually telehealth, when needed, can be used appropriately. And then increasing access and quality of care through efforts around infrastructure and broadband, and making technology equitable and enabled by the other support services it needs. One of the things that we missed an opportunity on is prevention. I think telehealth is often used in the context of acute care, but hardwiring in a reliable way prevention within telehealth and virtual health, which includes remote monitoring, which was helpful in the places where people could access it. Again, there's that gap. So I think using both policy, Medicaid expansion, CMMI, which is the Centers for Medicaid and Medicare Innovation, in the ways that we're able to address the equity issue as we build new care models and the associated technology. And tied to that is we've got to be careful about augmented intelligence, predictive analytics, and machine learning. We've seen data that suggests that could widen the gap, as well as care models that could widen the gap. So need to ask the question on, who are we leaving out, who are we not reaching by engaging in various technologies or care models? And because we asked that question, we were able to use our health risk assessment and comprehensive risk assessment, which we do within 30 days for patients and families that are new or going through a transition. We saw a 37.4% reduction in total social risk factors impacting health because we were able to understand where they were at and connect them to the right needs they had in that moment and over the long haul. So I think that is critical, that this conversation around technology is grounded in equity.
If I could add just one thing, building on Jay's comments, is it's also important to consider how telehealth can be utilized in community settings that can leverage the power of technology to utilize or to offer health services. I'm talking schools, early childhood centers, spaces that already know the community, have the trust of the community, and integrating health, especially during this time, is an opportune time to be responsive. And I think telehealth has opened doors to possibility of accessing those services where they may not have been open before. And while, yes, there are many barriers to that we'll talk about, I'm sure, later on as part of this conversation, but recognizing the opportunity that telehealth provides in reaching particularly some of our most marginalized communities through these alternative settings can really make a difference moving forward.
And Mayra, you're so spot on. And tied to that is, what is the investments we're making in the infrastructure to support community-based organizations, because they're not all created equal.
Right.
And so how do we support them to do exactly what you're suggesting?
Excellent points about the healthcare system as we move forward. And as we think about the healthcare system, we know the workforce is also critically important. So my next question is for Brian. You are Vice Chancellor of University of Arkansas for Medical Sciences, Diversity, Equity, and Inclusion, with nearly 30 years or over 30 years of experience in the field. So I kind of have a two-part question for you. Okay. Number one, just for clarity's sake, how is diversity, equity, and inclusion related to health equity? And then what's the role of medical schools or institutions, academic institutions in that?
Absolutely. So thank you so much for aging me, Chriselle. Much appreciated. But to answer your question, it's really twofold. When you think about not just medical schools, but UMS, as you know, it's kind of a comprehensive health sciences center where we have our 5 colleges and the graduate school. And when you think about workforce development in particular, we're both recruiting and preparing the next generation of healthcare professionals. And so one of the ways in which we contribute to health equity work is ensuring that we have representation, compositional diversity with regard to healthcare professionals, because that is tied to engendering that trust that we've talked about several times today. It also contributes to care as well. And we also want to prepare our students to be culturally responsive, regardless of their expression of diversity. Why is that important? Well, think about this for a sec. I do this by way of story. If you have a population that is not trusting of healthcare for both historical and or current reasons, and they go into a healthcare setting, and if you don't have a culturally responsive healthcare workforce, not just talking about the physicians, talking about the nurses, the techs, the whole care continuum, and they have a negative interaction, they're microaggressions, or they aren't dealt with well, guess what? That has a direct impact on their perceptions and their reality with regard to health. If I don't believe that you respect me, if I don't believe that you care about me, why would I listen to what you have to say? Why would I follow through? Why would I comply with any orders that you may have? I may not. As a matter of fact, when you ask me to come in for a follow-up, do I even come back for that follow-up? Because I don't want to be in that setting, that uncomfortable interpersonal situation. And the next time you see me, maybe at a time where the disease has manifested itself in a more negative way, that's become more acute, and I'm very, very sick. So you can see how that impacts health outcomes. So while the connection might not be as obvious, when we think about the impact it has on people and their interactions and the representation that you see in the healthcare system, that's what we focus on, starting from kindergarten as we start to cultivate the pipeline, if you will, to keep kids excited about STEM disciplines. And so they have the potential to enter in either at UMS or another institution that they're choosing. But that's sort of the work that we do with regard to workforce development. And that's the correlation it has to promoting health equity.
Thank you. Mayra, did you want, oh, you're not, okay, you're not okay. All right, great. So we have talked about a lot of different factors, and each of you have all gone up to the policy level each time. And Lupe, my question is for you. I love in your bio that you say you are a self-described scientist with an activist heart. My specific question to you is, how does your work, both internationally and your research, inform what you do today as Executive Director of the Latina Institute?
Thank you. I didn't realize you were going to hone in on that part of my bio, but I do consider myself that. And when I talk about the importance of access to healthcare for everyone in my role here at Latina Institute, it's very rooted in my own lived experience, and I think that that's part of that part of my identity. So I was born in Mexico City and immigrated with my family to the U.S. When I was 3 to find specialized healthcare for my brother who had a rare congenital disorder. And so I know firsthand what it means to fight for vital healthcare access. And, I am trained in neurobiology and did research in Latin America and Mexico on maternal mortality and maternal health. And while I've left the academic research space, I still think that my background helps inform how we best use data and research in the nonprofit space, in the space of movement building and organizing to support activism, to engender policy discussions that are tied both to the lived experiences of the community members we're working with, but also tied to the the data and the realities of studies that are being done about inequities. And I think that those two things combined are really powerful. So I'm able to use that background in this work. And so, at Latina Institute, I think one of the things that's very important to us is that thread, right? That our communities are always at the table, that we're heard, and that our lived experiences are not just considered, but centered in the work to shape policy and shift cultural narratives around healthcare access and other issues that intersect in folks' lives. And we're centered around the reproductive justice framework, which is an approach that was created by Black women in the 90s to center those most impacted, and with the recognition that many of the legal rights that we have in this country to healthcare access, especially around reproductive healthcare, are not real for many people because of the intersecting oppressions, intersecting injustices that they face in their communities every day. So many of the things that we've talked about today related to economics and transportation, just functional barriers. And so we really kind of tie all of that into the work that we do. And then, of course, around immigration. And because so many people in the Latino and Latinx community are immigrants or have immigrant family members, that question of the impact on immigrants of healthcare access is a really central part of the work that we do. And so I think one of the things that I'll add here is just that around reproductive healthcare angle, which we haven't talked about too much, that there are so many specific barriers that have been created in the pandemic, which have been existed and which, in fact, we're in a state of retrogression on a lot of reproductive health care in this country right now. But those things persist and will continue to get worse. And they're the things that frankly keep people out of regular healthcare as well. One of the things that we know is that for many women with low incomes, many women of color, OBGYN appointments are their only regular visit to the doctor and an entry point for a range of preventative care for a range of things like blood pressure checks, screening for breast cancer and cervical cancer. So I think that that's a really important point to lift up. And then, of course, the fact that our communities are largely uninsured, above and beyond many others, is a persistent issue, and that those economic barriers that again persist in the community and have been exacerbated by the pandemic are only getting worse. And as policies that are implemented by our government, our federal government, as they continue to exclude immigrants in provisions for health equity, provisions for economic safety, that will only continue to promote inequities in our communities and further exacerbate the harm that has been caused by the pandemic and the existing harm that is caused by a society that has marginalized many of our communities for a long time.
If I could just add, Dr. Nash, building on both Lupe's comments and actually Brian's comments from earlier, and thinking about, who it is that establishes trust with our communities, who it is that can help minimize barriers to care. It's important, who are we defining as part of our healthcare workforce? And, for many immigrant communities, for many communities of color, really lifting up the power of community health workers, promotoras. There's the number of titles that they take on depending on their responsibilities, but that speaks to the leadership of community members and what they contribute to our delivery system of care in ways that no medical degree is going to offer. Right? And it's not to take away from our medical professionals in any way, shape, or form, but to find ways in which we can partner and supplement those efforts to strengthen the overall system of care that is responsive to the needs of our communities, again, particularly our most marginalized. So it really builds on, Brian's comments about, the importance of trust building among communities, and then speaks to the unique challenges that we have to tackle that Lupe mentioned. So really thinking about community health workers and where they show up, particularly in response to the pandemic, and have showed up, is going to be important as we aim to build a more equitable system moving forward.
So Mayra, those are great points. And we think about the takeaways as a result of the pandemic, for instance, it just underscores all the points you just made, the importance of that, extending that care continuum, not just when you enter the hospital, but out in the community as well, and how important that is. And that's that sustainable infrastructure I alluded to earlier. How do we do that? How do we keep these networks on? How do we continue to engage these communities, not just in response to pandemics, but into preventive care as well? How do we get that messaging out? How do we own that? And so if you establish that trust in a sustained sort of way, it's about positioning. We're prepared then for the next crisis because the infrastructure is already in place. The lines of communication, the trust has been strengthened along the way. And so that's what you want to do. You want to be adaptive. You want to be strong so that you can deal with the next crises even more effectively.
That's right.
And I would just add that it's also taking the folks that we've trained, right? The contact tracers, the public health corps that are from the community health workers that Mayra mentioned, and then lifting up lived experience and supporting it so that I could shine in these environments moving forward.
Well, this has been such a rich experience with lots of nuggets of information. I'm taking notes furiously over here. But as we wind down, I would like to ask all of you a final question, because we have a broad audience with us today that is inside healthcare, outside of healthcare, in the business community. And my question specifically is, what can the average American do to help reduce disparities or improve health equity in their community? What would you have them do? And please feel free to add any final thoughts that we have not touched on that you would think are important for the audience to hear.
I would start by saying, becoming more engaged civically, having conversations with your community, with different people that are maybe not like you, so that we could understand that lived experience, the perspective of others, and come together. And we know that diversity can be our strength, and we can find common ground to move forward and contribute to the story and to the not only data that helps us illustrate the challenges, but the progress that's been made and how it's been made, and taking active place in advocacy and to Lupe's point, activism, using your voice, and I think we'll redefine what public-private partnership looks like, and that equitable recovery also relies on the engagement of members of the community and their experiences and their voice.
I would just like to add being open, being open to possibilities, especially when you're engaging people who are different. I would also say that looking at where you get your information, And one of the challenges was social media and some of the misinformation, some of the bad information that was out there. But just be more of a critical consumer of that, and be willing to share and have those conversations with your family and friends. It's okay to be critical. It's okay to seek more information. Just be engaged and active in doing so.
I agree with that entirely. And, I want to really highlight what Jay said about encouraging people to think about their neighbors and who their neighbors are, right? Like what you said, Dr. Nash, too, about the fact that we live side by side in our communities, right? Regardless of immigration status, regardless of racial or ethnic background, regardless of the myriad differences that we have, right? We live side by side, we're in community together, and that's a really central part of moving together as one and being able to move forward, that we consider that everybody wants the same things that we do. Immigrants want the same things that we do, and that's a really important thing to lift up. And then I'll just add that, give another plug for the Heal for Immigrant Families Act. I think being civically engaged, as was mentioned, is really important. Reaching out to your legislators about important legislation right now that's helping engender this momentum toward change that we need to recover from this pandemic, and frankly to get better than where we were before the pandemic on health equity. So the Heal for Immigrant Families Act, and then also another bill called the Women's Health Protection Act, which was just introduced in Congress, which specifically looks at abortion care access in the United States and removing unnecessary restrictions around that. These are really important policies that are in the pipeline right now as we speak, and that folks in the community can make their legislators aware of their support for them, would go a long way in, again, ensuring that we move toward equity in this country.
And I have the privilege of building on my fellow panelists' comments already, and to say, absolutely, I wholeheartedly agree with the need to become more engaged civically, to really make sure that we're critical thinkers and responders to information coming our way, and to work together and collaboratively. The only thing I would add, and this builds on Jay's points, is in reflecting in this last year of civil actions across the country in response to racial injustice and the pandemics, those calls to action that we heard in the streets, they were calls for justice, right? They were calls for justice by communities that have held the burden hundreds of years of systemic racism, state-sanctioned violence, trauma that's carried by them every day, that's carried by them in their health status. And I think that was put on display for everyone to see, who is most impacted by what's been happening with the pandemic and with racial injustice and what it's piled on top of. And I think it's important to recognize that fight for racial injustice or racial justice, it's intertwined with the fight for health justice. And as we think about the collective power of our communities to make change happen, finding that we are shared in our fight for justice is particularly important in ensuring that we're stronger together and that we're able to make these systemic changes to improve our healthcare system, our education system, our justice system, and our overall country for the well-being of our people. Being stronger together is what we need now more than ever.
So Mayra, those are great points. There's a wonderful intersection between social justice and health equity and the like. And the commonality are these systems of oppression, are these systems of continue to perpetuate in groups and out groups. The unique thing about, as I reflect here live, the unique thing about COVID-19 was that those lines became blurred, right? In terms of who's impacted. Became a common issue. It was COVID-19 did not discriminate with regard to now again, minority populations were because of other reasons were impacted, but in terms of the biology right associated, it did not discriminate, and so it forced us to come together to try to figure out these solutions and try to figure out these pockets, try to make sure that everybody had access, and it carried over into our vaccination programs. We had to address vaccine hesitancy, head on, because the health of the country and the economy and things like that were tied to it. So that's a great point you made there. I just wanted to acknowledge that.
definitely. This has been a wonderful experience to talk about this with you. And I just have to ditto everything you said. And that even though this is the last part of the conversations in health equity in this series, we have to continue these conversations to educate ourselves and each other. But I would also add and push us to move beyond conversation to action, as you all have said. These things have been long standing, and those of us who have been in the battle for years understand that. And I think that I would ask the audience to identify and to commit to an action. As you can see from our discussion, we're all involved in this, no matter what sector you're in, whether it's housing, whether it's IT, whether it's an employer, jobs, food, policy level, all of those. We're all interconnected, and we really all have a role in health equity. So I want to thank you all, and thank you, our panelists. We have a few minutes left. If there are any closing statements or things that you would like to say that we have not put out there today, but I would like to thank you for your work, your expertise, and sharing with the audience today.
Dr. Nash, I'd just like to say thank you for your leadership and for facilitating this conversation today and for all that you do. And I think the other point to build on what my colleagues have said is that people are watching. We're watching each other. The millions that are without insurance, those for whom coverage is eroded, those that are homeless, the 17 million going to bed hungry, one entire planet at risk for survival. We're all watching. And so, I think that this call to action is so critical and important to build, the work that's been started and move forward.
Absolutely, Jay. I think the last thing I want to leave organizations with is developing, systems of accountability and just being intentional when it comes to this work. It doesn't happen by magic. It won't happen by chance. You have to hit it head on, be intentional about doing the work, and holding yourselves accountable for the outcomes.
And I just have to say, as a child advocate, I think, someone mentioned earlier that we don't want this to be a moment in time, that this is going to be a long-term investment to make sure that we are reforming our systems for the future to be more equity-centered. And when we think about the impacts of the pandemic on our kids, particularly our kids who have been socially isolated, who have dealt with the grief of losing their parents or their grandparents to COVID-19, that's disproportionately impacted our kids of color, there's going to be decades of impact on their well-being. And how can we as a society ensure that we're prioritizing taking care of them and rebuilding them as much as possible as a result of this pandemic? I hope we don't lose sight of that and really recognize that investing in their well-being today is an actual investment in all of our well-being for the collective future.
Exactly.
Yeah. I'll just chime in that even though we've presented a lot of I think some dire conditions where we are, there is so much opportunity and so much ability to move forward, and echo everybody's statements about the call to action and that folks do have a part to play in this in our community and all throughout our country. So I think there's ample opportunity and we're poised to come out of this better than we were before the pandemic.
Exactly. There's definitely hope and expectation. So I would like to thank you for joining us this afternoon. I'd specifically like to thank the Bank of America, the Derek Lewis Foundation, the National Medical Association, Arkansas Medical, Dental, and Pharmaceutical Association, and the Clinton Presidential Center. And most importantly, thank you to the audience for joining us today in this critical issue. And as you heard, this critical issue that we will be working on and working toward health equity in the future. Thank you.